Always a pleasure. Thank you so much for the introduction. And on reality, my passion here is trying to translate medicalish to some type of language that we can actually do actionable things. We are hearing so many things right now in the news, in our own families, and a lot of the times, Facebook out, and all the Twitter stuff, or even LinkedIn. Oh, it's trying, that professional part is actually kind of melting around, and it's very hard to distinguish where we are, what's actually evidence based, what are fears, what do we actually know, and most importantly, what the things that we do not know. And part of this conversation, and thank you so much for the invitation, is just clarifying absolutely anything that you may have. The design of this conversation is 15 minutes, around 15 minutes of me talking. There's a chat box somewhere on the Zoom. Please send us your questions. I can talk my life away, and trust me, I have jokes and things to actually share with you, but it's more important for me to actually have this interaction with you. And maybe it's not you per se, but it's something that you heard on your family or someone on your team, or something that you wrote or read, read on the internet or something. Then just shoot at me on that one. A couple of things and rules on this conversation. We cannot say at all that we cannot say or talk about the vaccine, the COVID-19 vaccine. Right now, in the entire world, we have 210 candidates for a vaccine. Then it's always important to call the name and the last name of the vaccine. Here in the US, we have the COVID-19 vaccine for and from Moderna and Pfizer. Johnson and Johnson will probably have one that it's coming in the next following weeks. There's another one that it's cooking, that it's kind of being approved in other parts of the world. Is the AstraZeneca, and I'm going to talk about the basic part of this. A lot of us have heard, like, oh my God, they did a vaccine in 10 months. Supposedly it needs like decades of information and processing and that stuff. And a lot of people are kind of fearful, and that's perfectly fine because the message hasn't been clear. Is it new? Is it something old, or where we are? The good news for all of us in our communities is that this vaccine has been actually, the technology, the idea of fighting against coronavirus has been actually from 2002. There's two viruses that we probably you have heard from. One is SARS and the other one is MERS. They're cousins of COVID-19. They were in Asia and China, and there were a lot of technology that actually was amplified for them to use and prevent, the spread of these diseases. But because it was highly, the fatality rate was very, very high. 10 to 30% of people actually would die in a matter of days. It didn't spread out. It was an epidemic, but not a pandemic. Then on that moment that it was the initial part of 2000s, we started actually learning a lot of, coronaviruses. And that's why the technology that we have right now was finalized in a mass amount of vaccines in 10 months, yes, but the technology was already started almost 2 decades ago. Then we know that, no matter where we are, that's kind of the reality. For Pfizer and Moderna, they're using something called the RNA messenger. The messenger RNA, and I was switching in Spanglish. What's the objective of it? A lot of people go like, oh my God, my genetic code will be disassembled and destroyed and reassembled. On reality, it's actually easier than that. The objective of a vaccine, no matter if it's for COVID-19, for whooping cough or measles or whatever, is to make sure that your body is trained to respond to that bacteria, that virus, before it actually attacks your entire body. What do we know with the mRNA vaccine? It's practically just like a set of instructions. It sends it to your cell, and on your own cell, it started creating something called antibodies. The antibodies practically like laser missiles. They go against the virus right now, COVID-19, and that way, it destroys the virus before actually it starts creating more harm to you. What's the important thing? That yes, you can go the natural way that we have seen the pandemic. The natural way can actually create more problems, fevers, If you're lucky on that 80%, you will actually just have, a week of suffering and 10 days total of quarantine. And you need to survive. That's very important. You need to survive the whole process in order to actually get the antibodies. And we do not know right now how long those antibodies will last. And that's kind of the important thing. Then would I prefer to have these vaccines right now? 100%. I brought a little present for me to you. It's actually my vaccine card that I actually got vaccinated 3 weeks ago. And yes, 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 yes. I'm allergic to needles. It is part of the deal. I have not met anybody go like, yes, give me a needle right now. Not yet. But in reality, yes, I had like side effects, was redness on the arm, some mild pain on the area, and I felt tired. But as part of all the surgeons that I work with, and the doctors, nurses, and the amplified healthcare system, there was zero people that actually lost a day of work because of it. Then we were on the front line back in 15 minutes after they were watching us, and we were, there was, we went out, and yes, we had a little bit of pain, uncomfortable, but we were actually doing stuff. Usually you expect those side effects because that means that your body is actually creating and responding to that, and that's kind of a good sense of what's happening. For the second dose, what we're seeing is that those pains and maybe a little bit more of chills, a little bit more of tiredness, but that actually amplifies a little bit more. It's not significant. It's not like, oh my God, I will be like thrown like for a week, but it can happen. Then expect that. What's the magic medication that we prescribe? Well, in reality, we don't have any. It's kind of chicken soup and some Motrin or Thailand or whatever you prefer. That's kind of where we are with that one. And most importantly, a lot of people go like, well, doc, I already had COVID-19. Do I really need the vaccine? And the answer is, ta 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 ta, is yes, yes, yes. We actually need it. Yes, yes, yes. Why? Because we know that, we were talking about how your body creates antibodies when you're sick. We do not know how long they last, and we cannot predict how long they will last right now. And the same thing with the vaccines. Then we need actually to have a combination of both. That way we're covering absolutely everything. Then yes, you can have it. When can I have it if you already have COVID-19? You just need to wait the quarantine, those 10 days after exposure, after you're sick and all that stuff to actually get the vaccine. Um, can you get COVID-19 even if you got 2 vaccines? And the answer is yes, yes, yes. There's nothing sure in life except death and taxes. It's an old joke. I hate it, but it's true. That's why it's important that even though that you have the vaccine, that doesn't mean that you can go out there and party. It's 90+%, Pfizer and Moderna that covers you against bad disease, getting to the hospital, complications of COVID-19. But you're still a human. Maybe your immune system went down, or maybe you're on that lucky 10% that didn't produce antibodies. Then you still need to protect yourself. And the best example that I give you, because a lot of people go like, doc, I just hate the mask. It's not me. I have done this. I know that it's important, but I just hate it. I want to take it away. The thing is, with when you get the vaccine, it's the same way in principle as the seatbelt. When you got the seatbelt inside of your car, you actually do not get permission to start causing accidents whenever you drive, right? You do have that just in case if you have a problem. Then the idea of this is, like stay away from problems, but at least if you encounter a problem, you can easily be way better than just having the accident and have the steering wheel in any part of your body. Then that's kind of the process of the vaccine. I'm hearing a lot of the things that where we are with vaccines. California. I have here a question. Yes, doctor, thanks for being here and your work. What are the effects on the vaccination schedule if someone catches COVID after the first dose but before the second? On reality, we do not know specifically a lot of if it will make it better. You have more immune response afterwards. Right now, the recommendations for sure, Bill, is that we actually need to get the second one anyway. There's other viruses like chickenpox, varicella, that if you already got it and you're immune and you have antibodies, like you're okay. We don't give you the vaccine afterwards. But right now, because there's a lack of information, and it's not because it's not because we're not looking for it, but because everything, even though that we feel that we have been doing this for decades, we have a very short timeline right now of the things that we have, created for everybody. Then we need to wait to see which one is best. That maybe next year we will need only, if you already got it, maybe only one dose or maybe zero. But right now the recommendation is get the second vaccine. Bill, give me a thumbs up or a smiley face if I responded to your question, and if not, just add to a clarifying question over there. I would really appreciate that one. Um, then it's very important right now that we start dispelling the myths out there. It does not. You will hear in some conspiracy theories regarding the nanotechnology that it's inside of the vaccines, specifically for Moderna and Pfizer. And the reality is, yes, it has nanotechnology because they actually create like bubbles, and they package that in the instructions that we were talking, the mRNA, actually the instructions for our cells to create that, and they put like a bubble of fat, and they add sugar, they add water, and some other stuff. It's at least no more than 10 ingredients, and they shoot it out. That's the nanotechnology. It's not a radio cell, and a lot of people were very worried about having all this technology going inside of your blood and actually being controlled and stuff like that. Um, I call it cell phone. You don't need that high class of technology inside of you to actually change absolutely everything that you have. We already have cell phones, and don't worry about that one. If anybody tells you about that, that's not the way that it works. Um, the truth thing here right now is that we have certain communities, underserved communities, are being actually hit the most, and African Americans, Hispanos are actually on top of that list. And I will add actually Pacific Islanders and Native Americans. Those groups have been hit the most, and a lot of people go like, "Doc, well, why? Is it the virus is genetically modified to target certain genetic codes, or is there a story behind it? Is there a conspiracy theory that someone decided?" On reality, this is actually decades on the making. When you have a community that has a couple things that we call them social determinants of health, and a lot of people will go like, "Well, is the way that they live?" Is We'll get to that point, but it's called social determinants of health, and that means what we're eating. And before I actually go with that part, me as a doctor, when you come to me, I can control 5 to 10% of your destiny and your health. The other 90%, it's you and your environment. And by environment, it's absolutely everything: your mental health, your what you're eating, what you're doing, social stressors. And right now we are learning, even when you were inside of the womb of your mom, there's a lot of information and epigenetics, the way that your body actually changes with stress levels and hormones inside of your mom. Then there's a lot of things there. Then what happens with our communities? Well, if you have lack of nutrition sources of food, you're having issues with something called toxic stress. You're having a lot of other stuff, lack of opportunities, more, there's no environmental justice, that you're living besides a highway or in near industries and stuff like that. Then you have worsening of asthma, obesity, diabetes, and asthma, diabetes, obesity, hypertension, one of the most common things that complicate absolutely everything with COVID-19. Then you just need to add a little bit of gas and a spark, and you have a beautiful explosion, that like the one that we're seeing right now. Sadly, we're seeing decades of problems. Just when you stress that community has been suffering for a long time, this is what you get. And you add the part that most of the jobs that our communities are doing are frontline workers. They are doing public transportation. They even per se the jobs could be more open to exposure, and all of those can be brought home to the kids. Then we're seeing that part, like more Hispanos and African Americans end up on the hospitals, intensive care units, and dying, and same thing with kids. then we have something there. And sadly, right now with vaccinations, and I was talking with Carlos virtually this morning, that there was actually an article from LA Times and showcasing the disparities that, we all need the vaccine. That's, I'm a believer that the faster we all get vaccinated, the faster we actually can start like trying to stay away from mutations, start away from like fourth or fifth waves that they can come afterwards, opening schools and all that stuff. Then the problem is that right now the allocation of the vaccines are not equal. And I'm not talking about, people that are not thinking. We all know where we need to put them in. The thing is, the message is not getting there. Right now, the federal government is actually buying the vaccines. The states are actually like dispersing them, and the counties actually have the final call on this. They are following the CDC guidelines on who needs to be doing what, but ultimately the state has like flexibility to put priority groups on the line. And right now, the problem that I'm seeing, at least with LA County and Orange County, is that it's very hard to, if you implement, for example, technology solutions. And right now we have amazing websites that are doing a lot of things, even though that we don't have enough vaccines, but at least the structure is there. But I did something over the weekend that I tried actually to start as a 65-year-old male that speaks only Spanish, to the endpoint of trying to get a scheduled visit, scheduled vaccine, or somewhere that I can just put my email or my phone and they will call me back whenever it's my turn. That there were my inputs, and I couldn't make it. I started with Spanish and ended up in English, or there was no things, or there were a lot of complicated things, and it was not helping me. Then that's a reality of our community, and that's actually just a technology gap. But you have the language gap, and after that, most importantly, you have a huge. We can translate anything in Google right now. If someone actually tells me, translate Spanish to Serbian, I go to Google and I will have a decent translation in a couple of seconds. But that doesn't mean that it's culturally effective, or maybe it will be culturally offensive. Then that's where we need to actually bring the power of the communities, because a lot of our communities trust the doctor. That's a very important part of the community, and also the social partners, grandma, the aunties, the father, and we need to make sure that the influencer of the family have the weapons and the tools to actually translate a lot of these things and give them the opportunity for this. And that's where I'm sitting right now, trying to make sure that we're bringing enough information to our communities on a way that they want to have it, because they are in survival mode. We are in survival mode. We're running from one job to another. We're doing public transportation. We get like this glimpse of information, but at one moment we actually need to have that thing. And Diane, thank you for your question. What are your thoughts of the Johnson & Johnson vaccine? On reality, Diane, first of all, full disclosure, the best vaccine that you can get is the one that goes directly to your shoulder. Maybe next year you can choose the color, flavor, and the name. This year, you need to make sure that you just put something there that will be safe, approved by the FDA, and it's safe and secure, like the Johnson, like actually right now that we know about Moderna, Pfizer. Johnson & Johnson, the advantage compared to the other ones, it's only one dose. It's only one dose. It covers you around 70%, and they need to disclose the whole information. Then, it's still on the making that part of information. Then whenever I have more information, I can gladly share it with you. And it doesn't use special freezers or fridges, and then that's a little bit easier for places that don't have electricity, or they're far away, or a lot of other stuff. Then it's a awesome vaccine, and AstraZeneca is it's using the same one. Then it sounds that it will be very interesting to actually have.
Dr. Shapiro, sorry, interrupting your flow here a bit. We've got a couple of additional questions. Want to help you out here a little bit.
Thank you.
So we've got a question from Marche asking, what can we tell our families to encourage them and reassure them about the vaccination?
Well, first of all, let me tell you what I did it. And I think that actually will help this conversation. I did it for me, for my family, and for my community, my patients. That's the three things that I did it for. And And that's me as a person, as a human, as an evidence-based follower. We have already done more than 40 million doses in the U.S. That means almost 10%, a little bit more than 10% of the population, and it has been safe and effective with mild side effects. Then for the pandemic and the disaster that we have seen, mental health, uh, the sickness per se of COVID-19, then I do believe that having that vaccine creates a better solution for me and my family and my community. That's one. That's me as a person. Second one is that after, no healthcare system in the world, no country will sacrifice their first line of defense, their army, that's us as healthcare providers, to be the first ones to get vaccinated if they knew that they would kill us or they harm us. Or, if there was a doubt on that part, then it will be just massacre. It will be just it will be a moment of truth that I don't think that we are there. Then at least I felt comfortable enough that with 40,000 people that actually we were actually almost 80,000 people that were part of the initial research for Pfizer and Moderna. I felt comfortable enough that why not? The side effects are there. If FDA is approved, there's the information. Let's do it. I vaccinate myself every year for influenza. I vaccinate myself against other stuff. Then it sounds the same way. I'm a believer. The other thing is we need to acknowledge that we do not know certain things. Right now we do not know what to do with pregnant women or women that want to actually get pregnant. Why? Because usually the first round of research is done in adults, and after that they expand it to other populations, and they usually expand it to kids, and after that to pregnant women. Right now, the things that we do know is that this COVID-19 pandemic actually hurts more pregnant women and little kids. We know that. Then the FDA and CDC and all the providers actually opened the door and said, well, we have not seen any harmful events. We do not believe that that's going to happen. And the most important, we cannot recommend it because we don't have the data, but talk to your doctor, see if it's correct for you. And that's still my recommendation. Regarding kids, we know that kids supposed to be at school, not at home. And me as a pediatrician and a father, I really want them to be going to school. The thing here is that everybody's asking me regarding the vaccine. Again, we start with adults, and right now Pfizer and Moderna are doing research between 12 and 18, and probably will have results and actually vaccines probably by summer. That's my feeling. And less than 12, probably by December, we'll have more information regarding that. And I have another question here. How at risk are we in spreading the virus once we are fully vaccinated? Cynthia, that's a beautiful question. I cannot give you a percentage, but we can still spread it. The idea of the vaccine is not that we are completely immune from it, but it will not actually get us sick to the point that we will go to the hospital or intensive care unit or have chronic diseases from COVID-19, like the long haulers. And that's actually the objective. And we still need to protect ourselves. We still need to have the social distancing, and we need to get to a point. And it was 70 to 80% calculated a couple of weeks before and today, and that was taking into account that there were not a lot of different mutations of the virus. But if the mutations are changing, we will need to adjust that number. But at least 70 to 80% of the population needs to be protected. That way we can start like diminishing the virus. And the answer for that is the virus. The only industry of this virus, it's us as humans. Then if we actually separate each other and the virus doesn't use our cells to reproduce, we can actually control this better. And that's kind of the principle of social distancing. Then there will be probably a peak after Super Bowl that will be in 1 or 2 weeks, and we'll see a peak. Hopefully, will be a smaller and not like the ones that we saw in December and like New Year's and Christmas. But that's something that probably will happen.
I think we've got enough time, Doctor, for one more question. There's another question here from Valerie. How could you recommend reassuring individuals that think there was no flu this past year? Like, how do you have that conversation with folks?
Well, I would for sure tell them that the numbers were very, very low. If you there was a couple of hospital in Texas that they do the full panel when someone actually comes in, and they can actually check what viruses the patient was having at that moment, and a lot of the viruses actually went down, and and we are still getting the information on that one. And that can point to two things. One is that we as humans, when we're together in winter and stuff like that, we pass along a lot of these viruses, and using and doing washing and making sure that we're protecting each other can actually reduce the risk of influenza. Second of all is that when we go back to normal, I promise you influenza will go up, and we still need to have our influenza virus vaccine every year, because that's a, even though that it carries protection between 30 and 70%, I prefer to be 30 to 70% more protected than zero. Then that would be kind of my feeling of that one. And yes, I can start wrapping up absolutely everything. Then familia, I'm going to put you here my stuff, and I also in Facebook. Please send me your questions. I beg you. I live on memes and chains that are, that they need to be discovered and shared. Meaning, if there's, and that way I can demystify. It's kind of mythbusters thing. Then if you have any myth-busting things or questions, feel free to send it to me. I'm here completely for you. I love doing this. If you have a conversation with teachers or parents or other coworkers, I'm here for you completely. This is what I do. This is my passion, especially right now that we need to start converting medicalish to something that will actually help our community. That's kind of the way that I am, and it's very important. This is actually like my last phrase of absolutely everything before I thank you all for hearing all the crazy stuff that I have. We for sure need to start vaccinating our community against fear with a dose of truth. That's where we are right now. There's no healing process unless we start doing that ourselves. It's very important to understand that COVID-19 is a pandemic, but we actually saw, how what's the importance of creating resilient communities, resilient kids, resilient families, us eating well. We're going to go back to basics: eating well, having good conversation with the family, sleeping well, moving, managing our stress and anxiety, and most importantly, the community part. We need to continue checking and taking care of each other. Then, thank you so much for the invitation.